And we are back with the Flint community webinar, your community resource, every Friday at noon. Our wonderful partnership with Michigan State University, the Healthy Flint Research Coordinating Center, and we've got Genesee Health Systems with us today. So we're super excited to bring with you our panel of experts. Today, we're going to spend a little bit of time in the beginning answering some of those early questions that we had from last week. So last week, we talked a lot about RSV, and we talked about what RSV was doing in the community. We had the amazing Dr. Susan Woolford on and Nurse T, and everyone talking about what RSV was doing in the community. We had some questions we couldn't quite get to, so Dr. Woolford's going to help us out with some of those answers today. We've got Carrie Chanter here with us today, Director of Prevention and Health and Wellness with Genesee Health Systems. And the rest of what we talk about today is going to get into mental health. Right before we get into the holiday break, we're going to talk a lot about holiday stress, burnout, and the resources that we have in the community to think about and deal with holiday stress and burnout. So some of the questions that we had last week had to do with what should we expect with RSV, what was going on in the community, what are the resources available, what treatments might be out there. And because there were so many of those questions, we thought we would take the first few moments of this webinar and this week and just answer some of those questions before handing it off to our colleagues who are going to talk a little bit more about mental health. So if we could bring Dr. Woolford up, so that she can answer some questions for us and talk a little bit more about those questions that came up from last week.
Thank you so much, Dr. EJ. So I am going to share my screen here and talk a little bit about RSV. And if I were going to label this something, I would call it snot, which is such a terrible word, but shots and sick children. Okay. So, first of all, what is RSV? Well, it stands for respiratory syncytial virus. And I know you're saying to yourself, syncytial, what is that? Well, it actually refers to the fact that these cells in petri dishes and dishes in the lab come together. So think of a syndicate, things that come together. That's what these cells do. And so that's how it got the name respiratory syncytial virus. And how do we get it? So we get it from respiratory droplets, right? So if other people are coughing, breathing it out, we get it through respiratory droplets or by touching surfaces that have the germs on it. Now, these viruses can live on surfaces for quite a while. So I know you're all saying to yourself, wash your hands. Absolutely. That is what we need to do to protect ourselves from getting RSV. And of course, making sure that we're not coughing our virus out or breathing it out onto other people. Specifically, let's think about those who are most at risk. So we talked a lot last week about the symptoms and so on, but I want to highlight those people in our community who are most at risk. So infants 6 months and younger are more likely to have a severe course of RSV than our older children or adults. Premature babies are particularly at risk. So if a baby was born before they were due, that baby is really at risk for having a severe course of RSV. And then children with heart disease or lung disease or a weak immune system are also at increased risk. So we really want to protect them. And I know that Dr. Reynolds will be happy for me mentioning this, not because of the category that he is in, but because he always remembers the adults and I always forget them. But older adults, so those over 65, are also at increased risk for RSV. And we see a lot of RSV in our community in these winter months. Now, normally the peak for us is in February, but for some reason it's peaking earlier now. But we see a lot of it at this time. And in many adults, it's just a cold. But if you're older or if you're in one of these categories for these young children, then you're at risk for having a severe course. So one asks oneself, is there a shot for this? Is there a vaccine? There isn't actually a vaccine, but what we have is a monoclonal antibody. So those of you who have been looking at these webinars from the beginning will know that we've talked about monoclonal antibodies before, right? Mono being one and clonal being clones, that you make the same thing over and over again. And we talked about it before by thinking about like the Star Wars clones. So they make an antibody specifically against RSV, and we can give some young children this antibody during the period when they're most likely to be exposed to RSV, and that can protect them. So I'm going to stop sharing now and hope that I can illustrate this. So the reason why RSV is such a problem is because of what it does to the airways. So imagine that this from my kitchen, I think it's something you use to take the outer surface of garlic off. But anyway, think of this as an adult airway. It's nice and wide and air goes through it easily. Think of this as a baby. Their little bronchioles are much, much smaller, right? But when they're working fine and they're nice and open, I can blow this out, no problem, right? If I have with the baby one, the air is moving through theirs very well, I can blow this out, no problem. However, what our RSV does is it makes a lot of mucus. I prefer that word to snot, but anyway, it makes a lot of mucus. So think about this hair gel as mucus. And I have sucked some hair gel up into my straw here. Now, if it wouldn't make a difference in this, right? A little bit of mucus in here, big open space, it can go through easily. But now, if I try to blow this out, the air, not working, right? The air can't go through as easily. And that's what happens with these little airways. The kids can't get the oxygen, the air to go through because they're so blocked by the hair gel. So what can we do for these kids? What we do is we keep them well hydrated, right? So that thins out the secretions so they don't block the airway as much. Make sure they're well hydrated. And how you say, how do you do that? They don't want to drink. Well, you just give them small amounts frequently. And that helps to keep them hydrated. And if they really get bad enough that they have to come to the hospital, then we give them IV fluids. The other thing you can do is to suck out the airways, right? So, you have the bulb suction that you get in the hospital, or you can buy it from the pharmacy. I'm going to suck it out with what I had here. But if we can suck out those airways, you put the bulb suction at the nose and you suck it out. If you can get those airways clear that way, then when you blow through it, you have a much easier time of blowing out the airways. So once you've cleared out those secretions, and now when you blow, you can get it to go out. So that is what we want to do. We want to keep those airways clear by using the nasal saline and the bulb suctioning to suck it out. You want to make sure they're well hydrated so that those secretions are thin. If you're not successful in doing this and the baby is having a hard time breathing, and you'll know that because they flare their nostrils or they tug when they breathe here, or you can see their ribs when they're breathing, or they're a whole lot less active. These are reasons for you to make sure that child gets seen so that they can get help. And in the end, if needed, we can give oxygen to help keep them oxygenated through this period. Usually RSV lasts about 1 to 2 weeks. If it's going on for longer than that, that's another reason to go ahead and contact your pediatrician. So hopefully I covered the high points that we didn't get to last week. If there are any other questions, Dr. EJ, I'd be happy to address them.
Thank you so much for that really thorough explanation. That was so helpful. And I'm, even as a family doc, I'm thinking these are all the things that we do. This is such a helpful explanation. I'm stealing half of those illustrations because they were so accurate and helpful. It really helps us kind of think about what little kids are kind of dealing with as they deal with this virus and what our expectations should be. So thank you so much. All right. I think now that we've kind of got a better understanding of RSV and we feel like we've answered some of those questions last week, we get to hop into talking a little bit more about mental health. And I'm going to bring Carrie Chanter up to talk to us about all the amazing resources her organization at Genesee Health System has to offer us as we head into this holiday season and thinking about what can be a really fun time, but can also be a little bit stressful. So Carrie, talk to us a little bit about what those expectations to be and what resources you have over at Genesee Health Systems.
Thanks, EJ. When we're excited to be able to share some of the mental health resources that GHS can offer, and we have so many services we can offer, but when we thought about, all right, what do we want to talk about today? We're really excited to bring Lisa Bruder. She's the manager of our crisis services at our behavioral health urgent care. She's going to be talking about like the continuum from stress to burnout. And then we're going to transition over to Dexter Clark, who will be joining us shortly. He's coming from the ribbon cutting ceremony of our new children's building. He's going to be talking about the Pillars of Hope program, where we're bringing mental health out into the community through different churches and faith-based organizations we have partnered with. And then if we have time, we're going to talk a little bit about substance use during the holidays and how we can support those that are in recovery around us. So I am going to hand it over to Lisa, and she is going to talk to us about stress and burnout.
Thank you so much. I'm so excited to be here. For those who have seen me before, we were saying you've probably seen a similar presentation to this. We're going to guess about a year, maybe a little bit more than a year. So this is a really good time to have a refresher, to remind ourselves about our own wellness and some of the challenges that the work that we do can have on us neurologically. So again, my name is Lisa Bruder. I'm the manager of crisis services at Genesee Health System. I've had a number of positions at GHS. The last one, which was lots of educating. And I don't do tons of educating anymore, but when people call me to talk about secondary traumatic stress, I will always say yes. This information for me is like, we got to tell everyone. So your responsibility after today is that you're going to learn these things for yourself and your own personal wellness and insight, but then tell your friends. Let's make sure everyone knows about this. So my own personal journey is that I'm a clinician. I've had my master's degree for some time, and I've worked in pretty intensive clinical settings since that time. I was treating a patient probably 8 years ago, and we had a really tragic suicide event in our team, and I was a supervisor at the time. And I realized then that I was going to take complete control of my wellness so that I could do this job and this work and continue to be meaningful in my community and make a difference, and not allow myself to succumb to burnout, which is real and it's difficult and it takes a long time to heal from. And I've seen that happen to a lot of my peers. So my reason is my family and myself, and knowing that I experience difficult, hard things every day, and it's worth it to do the hard work to stay in a place of wellness. So this work costs, but it does not have to. And when I say this work, I just mean helpers, people who care, people who have the capacity to have empathy. That takes all of these situations like COVID-19, anti-Black racism and different racial injustices, community violence, our overdose crisis, the water crisis. It takes things, those compounded, complex traumas, and it weighs on our soul a bit heavier than individuals who perhaps don't function in a professional role that requires empathy, that requires understanding human nature and human need. Everyone here today has either a genuine personal want or a professional want to connect with people to support their needs. And that puts us at risk for experiencing trauma. So just to break down trauma, and that's a whole nother presentation that I love to give, but trauma is the event that results in a reaction. So trauma can be defined uniquely by every single person individually. What's trauma for me might not be trauma for you, and what's trauma for you might not be trauma to me. All of our life experiences kind of culminate to a moment that could be a traumatic event. The difficult experiences, the experiences that build resiliency, those are going to determine what happens next. if your body and your brain are impacted by trauma, that's called traumatization. So that's the internal and external resources that you have that are attempting to cope with that, and they become threatened. So trauma is defined individually by the experiencer. Neurologically, our brain is trained to recognize trauma and make a plan. It's survival, right? So we have that fight, flight, freeze, and submit. Our brain begins to shut down our non-essential tasks, and we can't think as clearly. And I always say I am horrible at math on my best day, but if I tried to learn algebra, if I was a young person in an educational setting trying to learn algebra, and my brain was in fight or flight, there is no way that I successfully could grasp that. And the same would be true in an environment like this. I work with crises all day, every day. I have to be aware of that so that I don't make decisions that could be a detriment to myself or the people I'm serving, knowing that our brain kind of shuts down some of those non-essential tasks when we're in a moment of crisis or trauma. The other most important thing is that it takes our brains 20 to 30 minutes to return to that full resting state. So again, in my clinic, we move faster than that. I'm going to get a new walk-in or a new call more than every 30 minutes. And so I prepare myself for that high level of adrenaline and potentially cortisol throughout my day by being really mindful of my experiences when I'm outside of work. And the bear, I think, is a really great demonstration. And it really says, sometimes we have jobs where we extend ourselves, or even if we're just stressed, we're trying to make a productivity limit or call so many people in one day, whatever the case is, we're out there and we're doing hard work. And sometimes it's like we're just running, keep moving, can't stop, got to jump over the fence. The bear's chasing me, I'm running, my boss is calling me, the bear's chasing me, right? All these things. And then we get home and the bear's outside the door, and we're inside the house and we forgot to tell our brain, you're not running anymore. The bear isn't chasing you anymore. And I'll share that in my own personal experience. If I'm running from the bear all day and then I walk into my house, even if my husband and family are like, welcome home, here's dinner, I love you, I feel irritable. My brain is like, go, 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 go. And they're like, hey, we're in different spaces. And so I have to do the internal work when I'm done here to make sure I'm in a safe place of wellness so that I can communicate with my family without feeling that irritability. So we know that trauma in small doses is okay. Or I'm sorry, not trauma. Stress in small doses is okay. First day of school, asking someone on a date. Those are small stresses that can build our competency and build our ability to manage stress. But long amounts of stress, long amounts of trauma can create our brain to be stuck in that alarm system, in that fight or flight all of the time, stuck in it or jumping into that more often than it should be. So then we're having emotional and physical responses to that stress. Stress causes headaches, that pain in your shoulders. It can cause racing heart, stomach aches, GI issues immediately. And then long term, we know that it can cause cancer and lung disease and cardiac issues. And so we want to be mindful of our experiences so that we can work on it on the back end. And we're going to talk about that balance in just a minute. So lots of words that are considered trauma. And I think we've kind of evolved with words over time as to alleviate the stigma associated with it. So secondary traumatic stress, that's the one that we use mostly in a clinical field. We have post-traumatic stress disorder, which is experienced by the person experiencing the event. And then also as a listener, as a helper, you're exposed to that person's trauma through them sharing their narrative. And secondary traumatic stress can have very similar symptoms to post-traumatic stress disorder. Vicarious trauma, occupational trauma, and early childhood trauma. And I have, it's not trauma, it's vicarious trauma, which so often if we're identifying someone who's perhaps acting dramatic, it's probably their trauma background and life experiences that have led them into that place of panic and stress. So that linear, if we look at what are all these terms floating around, let's put these in a linear fashion. So we start with secondary traumatic stress, and that's that experiencing other people's stressful moments, and it could happen throughout the day. Then we have vicarious trauma, which begins to kind of shift your cognitive ability. You begin to have more cognitive reactions, more jump to that alert and alarm status. When we keep going, we get to burnout. And sometimes the word burnout is used a little too frequently. And what I mean by that is that when you get to burnout, it's not a bubble bath. When you get to burnout, it's not a long weekend or even a week in Cancun. When you get to burnout, it is a very long period of time to return to wellness. This is a long standing, it took your brain, it was rewriting everything it knew in order to get to burnout, to retrain your brain to be on alert. When it gets to burnout and we need to go backwards, we have to rewire again and remind our brain that it's safe and that it doesn't need to be on alert. So we want to be aware of it as we're experiencing that secondary traumatic stress, as we're moving towards vicarious trauma and halting it long before we get to burnout. So who is at risk? All of you, helping professionals, people who are highly empathetic, people who have prior traumatic experiences. That's most people, even on our best day, but our community has experienced so much. None of us are immune to trauma at this point. Frequent exposure to trauma, remember that list at the beginning, it's been a rough 5-6 years. Socially isolated, which was compounded during COVID, and then inadequate understanding of stress. We don't know what we don't know, but once we know better, we do better. And today is that day. So today we're going to learn about all of the feelings that you could feel in your body if you're experiencing STS or moving towards vicarious trauma. And then it's going to be your job to say, I feel it, I recognize it, and I'm going to do something about it. So things you might feel, feeling exhausted, like chronically exhausted. Some days are exhausting, but if you're chronically exhausted, if you're running a marathon that doesn't stop, be mindful of that. What is the function of that behavior and feeling? Feeling cynical, feeling useless. Some days I have really great wins at my job, but some days in the world of crisis, it might feel like I didn't get any huge successes. Now I know rationally that if I can connect and sit with a person during their worst day, I have made a success. But if I'm looking for a more significant outcome, it can feel useless and hopeless. I got to recognize those thoughts when they come to me so that I can stop them and change them into more healthy thoughts and remind myself rationally, I know the work I do is meaningful. It could cause depression. It can cause negative feelings towards an activity. Like I used to love to do this, and now I just want to stay away. Be mindful of that. If you're feeling irritable, if you're struggling to focus, or you're not wanting to participate or go places with people that you care about. Things that could be seen and measured: trouble sleeping, headaches, weakened immune system, irritable bowels, frequent use of drugs and alcohol. We know that we as humans, people lean into substances when we're looking for an escape of stress. Before you lean into substances, remember, those are recreation, not coping. If you're using substances to cope, it might be something to check in on. Eating too much or too little, same with food, high blood pressure, and absenteeism. So specific to emotional reactions are irritability, feeling uncontrolled emotions. If you're crying out of nowhere and you're not sure why, it's time to do some self-toll on what's going on. Anxiety and fear, anger, rage, hostility, detachment or shutting down, boredom, and feeling incompetent. Cognitive reactions are diminished concentration, confusion, intrusive traumatic imagery. That could be about the trauma or not even related to the trauma, just intrusive, unhelpful thoughts or imagery. Having self-doubt, being preoccupied with other people's traumas. For anyone who's clinical on this call, you know that it's easier to focus on what's going on with other people so that we can avoid our own. We just do it. It's part of who we are as empaths. But that won't do you any good, because if you are not well yourself, you're not being helpful to other people. We also get stuck in perfectionistic thinking. Some behavioral reactions are feeling impatient, having sleep disturbances and nightmares, again, about the trauma or completely unrelated. Just that like level of hyper arousal is sticking with you through the night, causing those nightmares. Having an increased startle response, I have that for sure. It's something I keep a gauge on all the time. Feeling hypervigilant, using negative coping skills, and just losing things. Our memory can be impacted because our brain is so busy with all of the other survival things. Spiritual reactions, feeling that loss of purpose or feeling a sense of meaninglessness, being angry at a higher power that you once felt really connected to, questioning your prior spiritual beliefs, or feeling pervasively hopeless. Interpersonal reactions, withdrawing and isolating, decreased interest in sex or intimacy, mistrust in others, having an impact on your parenting, and all stress can impact your parenting. Once we know about it, we can maybe do things a little bit different. And it's impossible to not allow stress to impact your parenting some, but being aware of that and understanding where that line could be and what you can do to make those changes. We project anger and blame, and we're really intolerant of others' behaviors. If we're stuck in that irritability, perfectionist thinking, and someone else is having a difficult day, it's really hard to hold on to that sometimes. So how do we cope? We intellectualize it. I know you're all thinking about that. We deny it. Absolutely not me, right? That's their problem. I'm here to help people. I don't have to worry about that, right? That's not accurate. We can't deny that us ourselves are equally as impacted by trauma as every single person we serve. We minimize our own trauma, or how when we experience secondary trauma, the way that it can impact our body. We over-identify it, because if everything is trauma, nothing is trauma. So then we begin to say it's here and it's here and it's here and it's here, and this is trauma, 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 trauma. But then I'm not doing anything about it because it's everywhere. You become consumed by it. We get anxious, and remember that hyperarousal, that constant level of run, 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 run. And as we mentioned, we use drugs and alcohol. And again, if you're leaning into substances in order to cope, reach out to us. We'll talk about that in a minute. Some protective factors, knowing about stress, the risk factors, and self-care strategies. So you can check that off your list today. That's what we're here for. You're going to understand stress, risk factors, and how to take care of yourself. And daily self-care for mental illness. Daily. Every single day. So what we're going to do by taking care of ourselves, by being mindful and creating self-care, we're going to build resiliency. So resiliency is the brain's ability to maintain, to keep moving, to do all the things despite adversity, despite the traumatic event, despite having a really bad day. So that when I'm up here and I'm running walk-ins every 45 minutes where people are sharing the worst day of their lives, or I'm ducking punches because someone's really struggling, my brain is going to be strong enough to manage that so that I can keep showing up every single day to support my community. It also allows one to continue to pursue goals, even in the face of challenges. Otherwise, every day would be a block for what I'm aiming for in my life. And so we need to have the perseverance and the resilience to make it through each day so I can keep moving forward all the time. Resilience is not a personal trait. So it's not you either have it or you don't. If you're not in a space of immense resiliency today, you're in luck because you can develop it, you can build it, you can grow it. So instead, it is a product of interacting factors, including biological, psychological, social, and cultural. So it's that connection, it's that understanding, it's that feeling supported by your environment and the people around you. Resilient people are more likely to meet the demands of their daily lives. They're more likely to take action and deal with challenges. They're more likely to seek support. And I think that says a lot. Sometimes we identify with asking for help as being a weakness, but really data supports that the strongest people ask for help. We know when to stop and rest and replenish your inner resources. We have a sense of independence and self-efficacy. We form and maintain relationships with other people who have mutual likes, and we have a sense of purpose and goals for our future. Those are healthy markers for resilient people. It is unethical not to attend to your self-care as a helper because self-care prevents harming those we serve. So if you're a person who has been stuck in this is for them, I don't have to worry about me, I'm helping people, I'm going to keep helping people, Today is that limit that if you are not practicing self-care for your own wellness, it truly is unethical. These symptoms, these things can take over us, these reactions can take over us without us really noticing. And our hope is that people in our lives and community will address those with us. But I would hate for someone to be a year into feeling that way and not recognizing it. So self-care is an ethical responsibility for everyone. We have to find balance, right? Work and life. And sometimes there's extra work and sometimes there's extra life. But when we average it all out, that balance is crucial. So in order to do that, we use mindfulness, which is our capacity to clearly understand our own strengths and weaknesses and emotions and values. Get to know yourself and the things that you're really great at and the things that you need to work on. Get to know why your feelings are what they are. When you go 0 to 10 or 0 to 5, what caused that? Be mindful and learn about how you feel at any given moment. And then self-care is a behavior. It's an action. It's a thing that you're going to do to support your emotional health and physical health. And I didn't include all of the lists of self-care today because in truest form, it is unique to you and your wellness. Most things can be self-care. So you're going to choose something today that makes you feel better, something you can do for 5 minutes every single day, something that doesn't cost any money. So it could be sit and watch the sunshine outside. It could be to sit and do guided meditation with a YouTube channel. It could be coloring. It could be painting. But for those 5 minutes every single day, you're going to spend learning about the internal workings of yourself so that when you have a bad day, you immediately say, that was rough. And I owe myself some grace and some extra compassion today. So that self-awareness is the first step in mastering our lives and being independent and healthy in that space. It helps us notice what's rising within us so we're not in a state of trauma before we need to be. We can keep our arousal system calm and regulated and remind our brain it's safe because we understand that we're rising up. And self-awareness is being able to turn our gaze inward and really observe what's going on within our own bodies. So just an FYI, you can do what you love and still be tired. You can do what you love and still become burnout. And you can do what you love and still get excited about taking a break. And all those things are true simultaneously and important. Anyone that knows me know that I love my job. I love my agency. I will be here forever, mark my words. But I owe it to myself to always, first and foremost, take care of my own wellness and life. And that on the days that I feel tired, it's okay to feel that way. And I'm going to give myself that grace. So keep calm and practice self-care. And there's my email address if anyone has any questions. I know that was fast, but I had to give you all the good deeds.
Thank you so much, Lisa. Gosh, I learned something new every time I sit with you. Really.
I'm glad.
Yeah. So I'd like to remind all of the people that are on this webinar to make sure that you use the Q&A if you've got any kind of questions. We'll absolutely try to answer those. And I think it's so important that you know, a lot of times you talk about self-care, I think people feel like guilty, like, oh, I don't deserve this. But I just love that you reminded us that we need to have the grace and that we have to do self-care in order to help others.
You have to. You have to. This is your prescription today. You have to.
Yeah. So I'm hoping that everybody on the call takes your advice and starts implementing some sort of 5-minute exercise each day that can help with the self-care that we so need.
Absolutely.
So thank you so much, Lisa. And you can tell that you do love your job and are dedicated to the agency, which is awesome.
Thank you.
So we're going to go ahead and shift over to Dexter Clark. Dexter Clark is the Director of Faith-Based and Community Engagement Initiatives at Genesee Health System. So I would like to welcome him to present on the Pillars of Hope project that we have been implementing. So I'm going to go ahead and hand it over to you, Dexter.
Okay, thank you. Thank you, Carrie. And thank you for allowing me to be here just to talk a little bit about the Pillars of Hope. First of all, as stated, my position deals with community engagement and also dealing with Director of Faith-Based Initiatives. And, you've heard the saying where it always says that it takes a village to raise a child. Well, I also believe it takes a village to heal a community. We have to work together in order to heal one another. And as we look around, we see that there's so many issues going on in the world. We're dealing with the pandemic, we're dealing with the economy, we're dealing with racial strife and political strife and all of these type of things. And, it used to be when I was a small child, that, we didn't have certain organizations like GHS and stuff, but who took care of each other? It was your neighbor. It was your church and things like that. If I acted out, I had to worry about my neighbor also addressing those issues and things, but it was community involvement. And we don't have that now. Everybody is so isolated. Everybody's into their own thing. And like I said, there's so much going on in the world today. And media doesn't help, with that, because we're exposed to so many things, not just, when we cut on the TV when I was a child growing up, but now you have a cell phone, you have an iPad, you have all these type of things that you're constantly being bombarded with, media. You're constantly being bombarded with, stress and all of these things going on. And what happens is that, our mind is like a VCR or DVR. Now, it used to be VCR when I was growing up, but a DVR where, you're recording all these things. And what happens is that you're replaying it over and over and over again. And one of the things that we tell individuals that are dealing with stress and learning how to manage stress, we tell them to limit your exposure to a lot of media things, especially when they're negative. Now, if it's good things, Lisa talked about mindfulness and, surrounding yourself with positive thoughts. If you are, constantly being exposed to those type of things, that's great. But, a lot of times we know we're always dealing with a lot of the negative things that are happening, going on in the world. So we have to limit that, because if we don't, what happens is that DVR continues to replay it over and over and over again. And a lot of times it happens subconsciously. You wonder why you're irritable. You wonder why you're stressed out. Well, in the back of your mind, you're thinking about probably those things. You're worried about maybe what's going on in your community. Just last night, around 1 o'clock, I heard gunfire, in my neighborhood. So that's a stressful thing, And so what we have to do is limit our exposure to that. And what I want to do is give you a background of, how we came up with the Pillars of Hope. We realize, that there's stress. When you look at the news, when you look at the statistics, we're seeing an increase in suicide being completed by young adults, and you try to wonder, what does a young person have to worry about that puts them to the point where they feel that suicide is the only option? That is saying a lot about what is going on in the environment. We're also seeing, increased numbers in SUDs, substance use disorders, and, alcoholism and substance use. And a lot of times what is happening is people are trying to get away from stress. And they feel that if I drink enough alcohol, if I smoke enough, marijuana or something like that, I'll feel good and I won't have to deal with it. But the issue is that once you come off of that, once you sober up, the problem is still there. So, we have to learn how to manage our stress, how to deal with our stress. And one of the things as an agency, community mental health agency, is that we realize is that a lot of people will not come to the building, will not come to our agency. And that's there are a lot of reasons for that. One thing is sometimes it's a challenge with transportation. They don't have a means of getting down there. Another reason could be that they've had a bad experience with, certain agencies. And, there is this kind of mistrust in the government for a lot of reasons. And a lot of times, people just don't trust, an agency. They don't trust the government. And many times people are hesitant to come there and to talk about, what's going on in their lives and to be open and transparent, because they just don't trust that, it's going to be confidential and it's not going to be dealt with in a professional manner. Well, like I said, when we were growing up, there was so much community. There was a relationship formed with your neighbors and stuff that you learned to trust them. They learned to trust you. They saw when things weren't going well that they would come and help out. So we realized that a lot of the times we have the services available. We have everything that, somebody may need to deal with stress, to deal with substance use disorder, but people were not coming in. And we had to realize again that a lot of that had dealt with different challenges, and maybe stigma is another issue too. People don't want to have the stigma of saying, I am dealing with a mental illness. And especially in communities of color, we have always said, you just need to buck up, you need to just deal with it. But that's not always the case, because sometimes you can't deal with it alone. So we realized that we needed to bring those services into the community. And we had conversations with people in the community, especially in the religious realm. And a pastor had made a comment stating basically that, in my congregation, I have people coming to me dealing with anxiety, dealing with, stress, dealing with anger, dealing with, how to deal with my child and deal with these feelings of hopelessness and even suicidal ideation and suicidal thoughts. And he stated basically, I am not equipped to deal with that. Now, for the longest, the thought was always that, in a religious church, a religious realm, that, the thought or the mindset says, if you pray about it, then you're going to be okay. You're going to deal with it. And for years, that's what we would tell the congregation, just pray about it, trust in God, and you will be okay. But we realized that you needed more than that. Yes, it's good to pray. It's good to trust in God. But sometimes you're dealing with issues that you need to deal with somebody that deals with it professionally, that are trained. And pastors are now realizing that I am not trained. They didn't teach this in seminary, how to deal with anguish and how to deal with anger, and to a point where it's causing me not to think correctly, where it's causing me to hallucinate or dealing with other issues. So we realized that in order, as I stated earlier, there's sometimes a mistrust in government and agencies because sometimes they had bad experiences. So we realized that we need to align ourselves, partnership with organizations, with individuals in the community that the community trusts. And for the most part, people trust the church. The congregation trusts their pastor. So we realize that if we can align ourselves with them and work in collaboration with them, that we can open the door of trust. And that's how the Pillars of Hope came into an existence. And what we started out, and we're still in the pilot phase, is that we realized that a lot of people need assistance right now. They don't need to call someone and get put on hold. They don't need to call and make an appointment. But when they're going through an emotional crisis, they need assistance right now. So we came up with the idea of saying that we will have the link, the mechanism for them to be linked to that service. And what we did, we have outreach staff that many of them live in the community, in our communities. And so they are aware, and that builds a level of trust. But we set up a satellite setting where somebody comes in, they're feeling overwhelmed. They want to know, what do I need to do to deal with the stress? What do I need to do to deal with anxiety? My child is acting out and I don't know what to do. So we have provided, a way for them to link with them immediately, right then and there. And we have outreach staff that will talk to them, get them connected to the services right there. If somebody's dealing with anxiety, we can connect them either by phone or through, our computer with behavioral urgent care services. If a child is needing to be assessed for, behaviors or whatever, then we can link them up with that. So with the Pillars of Hope, we're looking at to establish an immediate connection with our services and to have it in real time so they can get there immediately.
Thank you so much, Dexter. You mentioned briefly on sometimes religious leaders and pastors may not necessarily have the training that they feel that they need. And I just want to let the viewers know that we are starting to do some more around suicide prevention, and you'll start to see more in this 2023. And I just want to remind everybody that we do have free training, a 1-hour webinar that is available to anybody that would like to take that. And we also have a faith-based version that is available for faith leaders in Genesee County. So if you are associated with any kind of congregation in Genesee County, that it doesn't have to be the pastor who takes the training, but it's of huge value. I mean, we were able to secure grant dollars to pay for this, and it's a 6 to 8 hour intensive training just for faith leaders. It doesn't have to be the pastor, but maybe somebody on the leadership team or staff of a church. If you know somebody who would like to do that, please have them reach out to me, and I'm happy to link them up with that training. So we not only have a gatekeeper training, like a 1 hour for anybody online training, but we also have one that's more geared towards faith leadership. So thank you so much, Dexter, for talking about the Pillars of Hope program. That is so valuable, and I'm so proud of our agency for being able to get out in the community and meet people exactly where they're at and feel comfortable. So thanks.
Welcome.
Yep. I am going to go ahead and transition on to my portion of the presentation today. We're going to talk about substance use during the holidays. And I think it's important to remember that the holidays bring a lot for many people. Depression, anxiety, and stress are all heightened for most people during the holidays. In fact, they say the most dangerous times of the year for anything drug-related deaths, whether it be accidents, overdoses, some suicides, are December, January, and March. We have nearly 91,000 deaths that have been reported in the month of December for the last 22 years. So December is a really rough time for many people. And studies do show that our drug overdoses are certainly up during the holidays. And that's because a lot of people, 25%, a quarter of Americans report having higher levels of depression during the holidays. And about 30% say they drink more during the holidays. People are getting together, they're going to parties, family get-togethers, after work drinks, that type of thing. So we know that drinking is up during the holidays and other substance use as well. For people that are in recovery, 94%, almost 100% report feeling overwhelmed or moderately stressed during the holidays. And so that can be a trigger for many people. The next two slides, I just want to remind what some of those triggers might be for us on the call. It's stress. I mean, I'm already starting to have a mild but good type of stress about the holidays. The snow makes me get a little excited, panicky. They're like, oh my gosh, Thanksgiving's next week. And then between Thanksgiving and Christmas, we just know that just rushes by, and there's gift giving and decorating and all these events and parties, and how about money? We got to find money to buy all these gifts sometimes. And how about seeing people that you don't necessarily want to see, or being in an airport and having to deal with traveling? So lots of stress, not always negative stress, but just stress. The isolation, certainly we keep talking about isolation and the results of that due to the pandemic, and a lot of times avoiding celebrations intentionally because of that. Holiday grieving. For some, the holidays bring up a time where they may be missing a family member that used to be there. And so they might revisit that grief when someone's not sitting at the table and family that they used to see. So we're surrounded by feelings of sadness or loneliness. And that puts people at an increased use of substance use and abuse. This next slide, talking about the last two triggers I wanted to talk about, is lack of support. People may not feel just supported. So sometimes people might want to drink more or use substances more. How about seasonal affective disorder? This is real. We have shorter days with less sunlight, and I've been actually feeling it a lot this last couple of weeks since the time change. The minute I get home, it's dark, and I don't want to go out for a walk. I don't want to go back out. I change my clothes, and I don't want to go back out. Sometimes we call it the winter blues, but really it is more than that for many. So how are we going to navigate these holidays upon us? This is perfect timing. Lisa gave some really great examples about self-care. I think this time more than any time is so important to make sure we're getting in whatever that self-care is for you. Five minutes of some downtime before you enter the house after work, some mindfulness practices, exercise. We have lots of snow, but that doesn't mean we have to stay inside. There's lots of great Michigan sports and activities that are done outside. Try to limit those triggers. The triggers we just talked about. If you know that some of those are triggers for you, if you can try to avoid those, that would be best. Setting boundaries, rehearsing how to decline an alcoholic beverage if you are in recovery or trying to stay abstinent during the holiday season. Try to rehearse what you'll say. No, I don't think that that doesn't sound good to me today, or I don't think so. You don't have to really explain why. And be intentional about those invitations. Just because you're invited to something does not mean that you have to attend. If anything, during the holidays, people understand that people are double booked or can't attend because I'm sick or I'm trying to avoid exposure to different illnesses. So just, you don't always have to say yes. Some more tips for navigating the holidays. Create a plan, kind of like practicing how you're going to respond. Create a plan. What places am I going to go to this year? Maybe you pick up a new healthy activity. Maybe that dog needs to be walked a little bit more, and you buy a nice pair of maybe some shoes that are not going to make you slip in the snow, some good boots, and put on a coat and get out and walk for 5 or 10 minutes. Pick up something that's new and exciting that you wanted to try, cross-country skiing or snowshoeing, or again, just going out for a walk could be a nice habit to get into. Seeking a support system. It's okay to reach out to people that might be able to help you and talk to a best friend, every other day. That might be your support system. Connecting with sober and supportive contacts. If you struggle with substance use, you know who your safe friends are to be around, those that are supportive. So seek those people out. Try to practice mindfulness and other meditation, kind of like what Lisa was saying. And, you don't have to be an expert at it. If you YouTube mindfulness practices, there will be a ton that will come up, and then you'll be able to pick whether you want a 3-minute one, a 5-minute one, a 10-minute one. So there's lots and lots of options that are out there for you. So let's say you're hosting. Hosting is so stressful, and I am hosting for Thanksgiving next week. So that's the good stress that I'm talking about. As a host, try to offer some non-alcoholic drinks. You don't have to have booze, beer, liquor. You don't have to have that at all holiday parties. Have fancy waters or juices, sparkling sodas, non-alcoholic options for people. Providing a variety of foods and snacks. Food can actually slow the absorption of alcohol and reduce the peak level of alcohol in the body by about 1/3. So if you are deciding to serve alcoholic beverages at your parties, please try to have some food around too for people to be able to snack on. Help your guests to get home safely. If you're serving alcohol at a party, that is your responsibility to really try to help plan for designated drivers or taxis and making sure people are safe to get home. So sorry. If you are a parent, understand the underage drinking laws and set a good example. It is still against the law to have someone drinking in your home that's under 21. Oh, sorry, I have a tickle. If you're concerned about mental health or substance use, we want you to call us. Those are the 2 numbers that are on the screen, and we will connect you to the right services. We will help you get screened and refer you to substance use disorder treatment for adults and adolescents. Some of the bullets listed below are the type of substance use disorder treatment that you might be eligible for, depending on how you score on the screening. Here's my contact information. I'd love for you to reach out to me if you have any kind of questions or getting linked up to any type of services and stuff. So I would like to open it up to the rest of the panel or make sure that people are putting questions in the Q&A box, and I'd be happy to answer any kind of questions. In the meantime, there was one other thing I wanted to share. Actually, Dexter was there today. We had a ribbon cutting ceremony for our new children's building. So I'm going to share this flyer that I put in the chat box. It's a PDF of our open house. So today was just the ribbon cutting, and that was mostly for press and dignitaries. And I know that they had to move it inside because of Mother Nature put that beautiful blanket of snow for us. But many of you probably have seen this beautiful building off of 69 and Grand Traverse right there. And so it's beautiful. It's beautiful inside. Staff have moved in. We are so close to being offering services. So this open house is Wednesday, November 30th from 3 to 6:30. Please come. There'll be refreshments there. There'll be staff. They'll be doing tours and things. And so we'd love for you to be able to come on out. So definitely share that flyer with any of your networks. We'd love for you to attend.
Carrie, this is like such helpful, useful information. And before we let you sneak away to all of the things you need to buy for your holiday party, and I imagine there's a bunch of grocery shopping in your future because I have my own set of grocery shopping that I need to do. I'm also hosting Thanksgiving. Pray for me, y'all. So a few questions. I know we have Nurse T and Dr. Gordon around in the background, and I wondered if they were hearing anything from the community about needs around stressors, needs as the holiday approaches, and things that they're seeing in the community that Carrie might, discuss in terms of resources that are available.
I know one thing that starts to trigger anxiety and stress is the daylight. A lot of times, we had summer, so we would go into work and it was daylight, and we would come home and it was still light outside. So now it's like that seasonal depression of, not having the sun, not being able to be outside, and it's getting dark around 5 o'clock, which is really depressing. So it's like that the daylight affects a lot of people because it cuts down on the safety of what they're allowed to do. So if they were able to visit their loved ones or go to the grocery store, now they can't go because they don't have the daylight savings to help them feel secure in the area of their neighborhood. So what I'm hearing a lot about is that it's getting dark early. And even the other day, my mom was like, you got to get home. I got to get home. And so that is very depressing for the community.
And I imagine even the idea, that's why I appreciate Carrie talking about daylight savings time and thinking about that, and how how you get home and it's dark, because it allows us to at least think about it and put it into context. And that way we might say, I need to get that walk in during my lunch break, because I know when I get off, it's going to be dark. I remember even as a resident, right, we would try to get outside when we were in the hospital for lunch, or to even just to walk from one building to another, because you get out at 6 o'clock and it is dark out and there's not a lot you can do about it. So you miss out on that sort of natural sunshine and natural sort of depression treatment. One of the things that we also talked about as we head into this holiday season is being mindful and thoughtful about alcohol and substance use. And I really appreciate Carrie highlighting that both if you're hosting, have some options for your people who may not want to imbibe, who aren't necessarily interested in that glass of wine that I love so much, or that glass of champagne, might want a sparkling water or sparkling apple juice. And even for the little kiddos, so that they can feel like they're involved. As thank you to Dr. Woolford for talking to us about our kiddos earlier. So a bunch of really helpful, useful information. And I really appreciate the wealth of services that you provide with Genesee Health Systems, and that you provided us today as we think about heading into that holiday season. Thank you so much.
Thank you. There was a question about, different healthy foods and stuff. Things that come to my mind are, your traditional things like a veggie tray, maybe you have hummus and pita chips and crackers and cheese and, those types of things. It doesn't have to be big loaves. People always say, oh, the bread absorbs the alcohol. Well, Yeah, have some crackers, maybe some baguettes, or something like that. But, those healthy fruits and vegetables, I do think people do not eat enough of that in the wintertime because it's not always like in season, right?
Right. And they're not in our gardens anymore. I totally get it. I want to, and a big shout out for water, right? I'm sure Dr. Woolford is somewhere saying, drink your water and thin out your secretions. So I want to give a reminder to people that in celebration of some due time off for people, that there will be no webinar due to Thanksgiving. And I am so thankful for all of you who are here and shared your expertise and your time with us. We will see you after the Thanksgiving break. Thank you so much for your time and attention today. A reminder about how to access continuing education for CHWs and contact hours for social workers. All the information is right there on the slide. Thank you again for joining us.